Now let's talk a little bit about leg ulcerations. And leg ulcerations are the long-standing consequence of venous reflux disease. Again, fairly rare, but something that we see in our patient population with enough frequency that it deserves some discussion. Leg ulcerations begin with what is called stasis dermatitis. It's a low-grade chronic inflammatory condition that begins because of this static high-pressure blood that congests within the subcutaneous tissues and skin in the legs. It presents with dry, flaky skin, sort of a scaly rash. It's reddened, it's a little bit bumpy, frequently itchy. It's sometimes mistaken for psoriasis or some other form of rash and treated with steroids, to which it does respond, but the root cause of it is the varicose veins and the reflux disease, and until those are treated, it can't be cured. When stasis dermatitis is present for long periods of time, usually years, it will progress eventually to stasis ulceration. What a stasis ulceration is the full thickness necrosis or loss of skin, denuding the skin surface and laying bare the subcutaneous tissues. Those occur mostly in the lower half of the calf and around the ankles. They can be very painful. They leave patients prone to infections. They are a great nuisance, both functionally and interfere with patients' work. They take a lot of time and effort for curing, for dressings, for things like that. And the underlying venous disease really needs to be treated to cure that process. At times, stasis ulcerations can even progress to life-threatening infections within the legs, so-called cellulitis. So how will you know if you're developing stasis ulcerations? Well, it really isn't any big mystery. Long before you develop the stasis ulceration, most patients will get some of this stasis dermatitis, and their skin becomes discolored, sort of a brownish discoloration. It gets dry, itchy, flaky. Ulcers typically are fairly small when they start. If left untreated, they can grow to very significant sizes, but very rarely does something like that happen overnight. Again, it's not something that patients need to be overly afraid of, that they will suddenly wake up one morning and have a terrible stasis ulceration and will have lost the chance to treat themselves. When we see those patients, we institute a protocol and generally are quite successful in getting those ulcerations to heal, but it really takes more than home remedies.